Welcome to the November 2019 Data Update. Today we will introduce the North Sound ACH Monitoring, Evaluation, and Learning Plan. I'm Nika Osteen.
And I am Leah Wainman.
And today we are joined by Erin Hertel from the Center for Community Health and Evaluation. Let's begin by reviewing important talking points for today's data presentation. We will begin with an introduction into evaluation and why we evaluate. Then we will introduce the North Sound ACH Evaluation Plan. And finally, we will close with the next steps for this evaluation. We'd like to begin with a land acknowledgement. We begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. There's one document that will be helpful to reference throughout this webinar. It's the North Sound ACH Monitoring, Evaluation, and Learning Plan Overview Report, which you can find on our website or on the partner portal. We would like to start with a short video that will provide some context as to why we evaluate projects.
What scares you the most about evaluation? Is it a funder asking questions like, did it work? Did you do what you said you would? Why do you think you deserve more money? Or your boss asking, why are we spending money on this? Does this really help achieve our goals? Is this worth the effort? Or it could be your team wondering, what if our work doesn't measure up? What if we look bad? What if? Or maybe a voice in your head is echoing these fears. It's my fault, we didn't get better results. My funder is going to pull the plug. I'm going to lose my job. I will never be able to work in this town again. My parents will disown me. But wait, what if evaluation isn't scary at all? What if it's actually the best thing that you've ever done? What if evaluation helps you learn something critical to your future success? What if your staff learn how to get better results? What if your funders learn something that will help them make better choices? What if the community learns more about what you've accomplished? What if you learn that evaluation is actually your friend? Because after all, evaluation is all about learning. And evaluation can actually make you a hero. And your programs become more effective and your learners learn more. Your funders give you more money to increase your impact. Your boss gives you a promotion. Your entire team knows that what they're doing matters and makes a difference. Don't fear evaluation. It might be the best thing you ever do.
So, what is evaluation? Evaluation is a systematic method for collecting, analyzing, and using data to examine the effectiveness and efficiency of programs and, as important, to contribute to the continuous program improvement. The image here really poses a better question: what isn't evaluation? This is because evaluation should be embedded in all phases of a project or program. It should be considered at the beginning, and implementation, and throughout the continuous quality improvement. A strong evaluation can help us identify our best investments as well as determine how to establish and sustain them as optimal practice. Our goal is to increase the use of evaluation data for continuous program improvement across the organization. Beginning in April 2019, North Sound ACH staff began the work of creating this evaluation plan. In early 2019, the North Sound ACH started contract negotiations with the Center of Community Health and Evaluation. Here on out, we will say CCHE. In May 2019, CCHE staff and North Sound ACH staff began weekly phone consultations to start evaluation planning. We discussed how best to provide evaluation design and to support our success. Evaluation planning occurred in 2 phases. One, initial exploratory phase, where CCHE explored the Medicaid Transformation Project, evaluation, quality improvement, and monitoring goals, and available North Sound ACH resources to create a strategy document for moving forward. The second phase being the design phase, where CCHE, in collaboration with North Sound ACH staff, developed a full evaluation and quality improvement plan, including logic models, indicators, data sources, and analysis and dissemination plans.
Right, now we're going to pass it over to Erin Hertel from CCHE.
Thanks to you both. As Niga just mentioned, my name is Erin, and I'm delighted to be partnering with North Sound ACH on your monitoring and evaluation and learning plan. We are the Center for Community Health and Evaluation, or CCHE, and just a little bit about us. We're a Seattle-based evaluation team that partners with communities all across the state and the country to help them understand how they're making progress towards their goals. We focus on creating evaluations that are relevant and useful, and really on the continuous learning that came out in that video, and I know the focus of North Sound ACH's work. We want to learn while the initiative is unfolding so that it can go stronger. I have a deep background in working with ACHs. I led the statewide ACH evaluation under SIM funding from 2015 to 2019, and during that time I was lucky enough to work with ACHs across the state, including North Sound. So I'm excited to be able to dig into working directly with your ACH on the evaluation planning and implementation that we're going to be presenting today. Before we dig into the details of the evaluation, I wanted to ground our presentation in the key components of the evaluation approach that we've developed with North Sound ACH. And I hope that this looks familiar to you as we walk through it. These collaboration approach components should be aligned with the way North Sound does its work across the board. The evaluation is designed to balance a high-level look at strategies to understand where there's progress and impact, with a deeper dive into particular areas that are of importance to the ACH. And the strategy focuses on utilizing existing data to minimize the burden on partners and ACH staff. As has been emphasized before, it's really about gathering data and feedback along the way for learning and for continuous improvement, including understanding what's working and what's not working, so that you can collaboratively tackle issues to make the initiative stronger. And together with ACH staff, we've created an approach and work plan that focuses on keeping the evaluation and the reporting of results back to you relevant. Throughout the year, we really see this as a living document that should remain useful as your work evolves and moves forward.
All right, so evaluation questions are high-level questions that you want to answer with your evaluation plan. One of the first steps of our design was defining what we want to know from this evaluation. So during the planning process, we worked closely with Erin at CCHE to develop 6 evaluation questions.
Yeah, and as you can see, all of these questions follow the same format. We'll start with these 3 and then go to the next 3 in a minute. But they focus on different aspects of success, what success could look like for the ACH. So I'm going to orient each of them here quickly, and then we'll walk through each one specifically. So the first question focuses on the work of ACH staff and boards specifically, and their role in providing strategic direction and capacity building support for effective and sustainable transformation efforts. And the remainder of the questions then focus in on the work of the partners in the ACH together to impact the North Sound region in a variety of ways. So the second question focuses on understanding if you've built the capacity to effectively implement strategies. And the third focuses on that secret sauce of building the important collaboration, partnerships, and strategy needed to transform a system. The fourth question focuses on the implementation of the strategies that's actively going on across your region right now, and to see if there's sustainable system, practice, and policy changes that are necessary for transformation. The fifth focuses on the important work around understanding if there's been an impact on health and well-being. And the sixth on the level of capacity that was built to address equity and disparities. At a high level, I'd point out that these questions are purposefully aligned with the way that the ACH has already articulated and designed the work that you're doing, including the types of strategies you've committed to around building capacities and implementing strategies in the importance of equity. Again, the goal is not to add a lot of additional data collection, but to document and understand the effectiveness of the work you've committed to do. So now let's walk through each one in a little bit more detail to give you a better sense of what we'll be looking at related to each question. So as this first question shows, it really focuses in on the work the ACH and the board are doing to support partner efforts. You can see elements here about how the ACH's role as a convener is going, specifically how decisions are made and how the work is going to support a sustainable legacy. There's also a strong focus on their support for capacity building and supporting the kind of QI work and other things that partners will be focusing on. The second question, again, is about capacity building, which is a key component of the North Sound ACH strategy and shows up in the work that you've committed to. And this question moves into understanding if that capacity has been built in the region, which is a cornerstone of being able to successfully implement strategies. It calls out the specific types of capacity building that were included in partner agreements, from QI and leadership to capacity changes at organizations, and then the capacities that can grow in the regions between organizations. Hopefully these areas look familiar to you, as much of the data to answer this question is going to come through the reporting systems that are already in place. This third question gets at that necessary but often ambiguous element of collaboration. System change can't happen without it, but we need to move beyond the idea of you'll know it when you see it to actually figuring out how to document progress in collaboration development and understanding where there's areas that still need improvement. So we'll be looking at specific types of collaboration that are indicators of system change, including things like new and informal partnerships that are being created, what types they are, if they're showing up within, across sectors, or across geography, or the level of alignment in strategies across multiple organizations. We're going to be doing a deeper dive look at the oral health LIN as a unique model to grow this type of collaboration. And we'll be conducting a survey in 2020 to understand the current state of collaboration and help pinpoint areas that this work can grow. If the last question got at the elusive secret sauce of the work, this fourth question is the mega question that really looks at the progress and outcomes of all the strategies that are being implemented across the region. Again, the majority of the data to understand this will be coming from the reporting systems that are already in place and from data sources that are available through the state. We're going to be trying to understand progress and effectiveness and the types of changes in system policy and practice that you'll be reporting to the ACH through the portal and that they'll find out during site visits. And as the work progresses, we also want to be able to track the spread, scale, and sustainability of the strategies that are being implemented to understand how collectively they are working together to improve health and transform the system in your region. All of the work that you're doing to transform the system is in service to outcomes that may take a while to get to, like the outcome that's outlined in this particular question. Changes in health and well-being that are understandable at a population health level can take a while to see change in those particular measures. And so while we'll be keeping an eye on that, we're also going to be building in some shorter-term outcomes that indicate progress towards this goal, including lifting up bright spots and highlighting partner stories that demonstrate how an impact on regional health and well-being is being felt in different spots across the region. And then, of course, as I said before, keeping an eye on that broader population health outcome data that we will hope to see changes in over time. Last but not least is a question that elevates your ACH's commitment to addressing equity. We'll be looking at a variety of elements here, including participation in ongoing work and change in awareness and capacity to address these key issues. The ACH will be building in universal metrics and targeted strategies to bring the power of targeted universalism approach to bear in the region. And we'll be paying attention to the benefits and burdens that occur in the region based on strategies, including trying to get at the patient experience and that idea of feeling belonged.
Okay, this slide is a quick look at the key question. Now that we have all of these questions, how will we answer them? Hopefully, the size of the circles here is conveying the point that we've brought up a couple of times in this presentation around the fact that the key principle is utilizing existing data to minimize the burden on both partners and the ACH. We will be using a wide variety of data sources. This will include data that we collect internally, such as reporting and webinar evaluations, data that we collect from other ACH document and activities, such as staff notes and board meeting notes, data that is collected by other organizations like the Healthcare Authority and the All Payers Claims Database, and reports from external organizations. Most implementation can be measured with quantitative data, including the reporting portal, OHSU's evaluation data, the APCD data, Healthier Washington dashboard data, the CCS Care Coordination Systems platform being used by the hub. DSHS provides us with some decomposition data, and the Healthier Washington data. The reporting portal will measure percentages and numbers not started, in progress, or completed for a specific strategy. OHSU is listed as a data source, but at this time, the inclusion of the data source is a speculation or to be determined. All Payers Claims Database will be utilized for public health surveillance, representative samples, in death case studies, and P4P monitoring. Healthier Washington dashboard provides additional metrics not included as P4P metrics. The CCS platform data will be used to support care coordination, representative samples, and case studies, and for a standalone hub evaluation. DSHS decomposition data is provided on a quarterly basis and provides in-depth demographic data. For each of the evaluation questions, we will also have qualitative data sources to support the quantitative data sources. These include reporting portal narrative questions, site visit notes. CCHE will be conducting interviews with the representative sample of organizations. We will be reviewing meeting minutes, and we will also collect staff notes from convenings and events. In addition, we will standardize how we analyze qualitative data using 3 main themes. Sub-themes may be identified under each theme. These themes will assist with the organization of report writing and communication of evaluation findings. Next, we will also continue to learn from other ACHs. Since we began planning and writing the evaluation plan, as we move forward with implementation in the evaluation plan in 2020, the North Sound ACH staff will continue to learn from other ACHs and collaborate on evaluation efforts. Specifically with the ACHs with alignment and project area commitments, as we've outlined here. These include North Central ACH, Olympic Community of Health, Cascade Pacific Alliance, and Better Health Together.
So this last slide is a quick look at what the rhythm of evaluation will look like in the next year. And below the line in each column is just a short summary of all the ongoing work that's happening already. And you just heard a summary of all those secondary data sources and ongoing data collection efforts that are already part of the ACH work from Leah. For example, the portal reporting that will feed into the evaluation. But above the line are the newer activities that she mentioned that we're going to be adding in to specifically get at some of those pieces that aren't possible to get from current data reporting. And so we're going to be planning to start with a partner survey in early 2020 to get a baseline and highlight areas that could need continuous improvement around collaboration and partnership and ACH effectiveness. And then in the middle of the year, next year, as was mentioned, we're going to be doing a series of interviews with a sample of folks to dig in deeper on areas that came out in the partner survey and what has been raised in the reporting portal and other ongoing reporting, so that we really understand areas for improvement and how we can dig into that collaboratively together. And while the ACH will be planning to report along the way, there's also likely to be a more comprehensive summary later in the year of 2020 that pulls everything together and offers a chance to really look back across the year in a way that puts all the pieces together. So assuming this flow works really well, next year we'll be following the same rhythm in the following year. And so we've thrown early 2021 up here, and we'll be again doing another partner survey to continue learning about how things are moving forward. And there'll be additional pieces like portal reporting, and the existing data collection and convening feedback will be ongoing as well.
All right, so if you have any additional questions, comments, or feedback on this evaluation plan, please feel free to contact us at team@northsoundach.org. We would love to thank Erin for all of her help in developing this plan and her continuous help throughout the coming years, and for helping us present today. So thank you all for your attention, and please feel free to reach out.
Thank you.